Good afternoon, everyone, and welcome to another episode of Fertility Talk. Today we've got Dr. Matlhaga. He is from Hope Fertility Clinic, and I'm so glad to have you, Doctor. Welcome.
Thank you so much for having us today, and good afternoon to all the viewers and the listeners.
Pleasure. It's an absolute pleasure. Thank you. So we're going to talk about ovarian reserve and AMH testing. And then we've got our first question, so we're going to jump right into it. What is ovarian reserve and why is it important for family? For fertility.
So I'm going to try and simplify things and say ovarian reserve really means the number of oocytes or eggs or potential eggs that remain in the ovary at any given time. So you can check it, when you're 30, you can check it when you're 35, or even earlier. So at that point in time, when you're testing the ovarian reserve, you're essentially looking at the number of eggs that are remaining in the ovary.
Okay. Thank
Yeah.
you. Next question is how is so it's the AMH, anti-Müllerian hormone testing used to assess ovarian reserve, and what do the results indicate?
So there's a number of tests to test ovarian reserve, and AMH is one of them. It's not the alpha and the omega.
Yeah.
It's one of them, but because you're asking about AMH, I'll talk about it specifically. So AMH is some sort of a protein or a hormone that is produced by the cells, a particular cell, the granulosa cell in the ovary. And this hormone is produced by your potential eggs. So it goes without saying that the higher it is, the higher the potential that you will have eggs. And there's a good correlation or a fair correlation in terms of its level and our expectations. So it gives you an expectations in terms of the number of eggs, not necessarily the quality, just the number of eggs at that point in time. And it's not affected by your cycle, whereas other markers, they depend whether you're on your first half of your period or your cycle or the second half of your cycle. AMH tends to remain consistent between periods, intra-period, and it's really a good indication or an estimate to guide our expectations in terms of what's going to happen going forward.
Okay, thank you, Doctor. Our next question is, at what age should women consider testing their AMH levels, and how often should they check it?
Sure, that's a difficult one, and I understand because a lot of people want to know. I suppose we normally worry about AMH when we are going to do something. We don't routinely check it just to know. So it's a very difficult one. If I were to say to someone, check it every 2 years, it's not going to help. If I were to say to someone, check it, at the age of 30, you have to know why you're checking it. So I would say let's get into a group of people who are still looking to fall pregnant. It's a useful tool there. So you can check your AMH now, but remember it tells you about now. And you will never know how it's going to look like a year later or 2 years later. So that's one thing everyone must know. But more importantly, I think its role is very critical in terms of where intervention is going to happen around the ovary for whatever reason. I'll give you an example. If a patient is going to go for surgery or any trauma or cutting of the ovary from surgery, whether it's endometriosis, whether it's cysts, anything around the ovary, if someone is going to go for something that's going to affect the ovary in terms of blood supply, something like uterine embolization for fibroids, I think there it's very important to know where you are starting from. Because after that procedure, it may be low or absent, and you will never know whether you started with an absent or lower. Number one. Number two, if it's really low for what we expect at your age, then you can be more cautious and say, you know what, for fertility purposes, let me rather not do anything that's going to compromise this ovarian reserve any further.
Yeah.
I think in those instances, it's very important and critical. But just as a need to know or nice to know kind of thing, I don't think it will help us, because you will know today, but it doesn't tell you anything about tomorrow or next day.
Okay.
Yeah.
Thank you. So there's a good one is, can lifestyle factors such as diet, stress, or supplements influence AMH levels and ovarian reserve?
Not really. I'll only touch on one
Mm.
in lifestyle. Smoking of anything. Smoking of anything, whether it's happily bubbly, tobacco smoking, I don't know, tends to sort of decrease your ovarian health, so to speak.
Yes.
And AMH or ovarian reserve is one of those issues that we look at when we look at ovarian health. So I would say yes, lifestyle is important. If you're gonna drink heavily, if you're gonna especially particularly smoke heavily, if you're gonna be working in radiation environments, exposed to X-ray beams or cell phone networks at very, those kind of things, they really affect your ovary. If you're gonna have chemotherapy or you're working with agents in that same space, then you need to be careful, because those can affect your ovarian health and it can really deteriorate very fast.
Okay, thank you. Our next one is, does a low AMH level always mean infertility? And are there treatment options to improve egg quality?
So I'll take the last one and deal with it first. When
Okay.
we talk about egg quality,
Yeah.
it's very difficult to test the egg quality. It's usually on hindsight. The true test of egg quality is what we see.
Yeah.
The kind of embryo that you have produced, the kind of egg that you have produced. So we can never know before. But what we know is that the age is an important marker of quality, for the simple reason that for women and girls, you get given your stock and it's fresh and strong the younger you are.
Yeah.
And as you age with your stock of eggs or your batch of eggs, and there's really no new eggs coming in.
Yeah.
Whereas if you look at the guys or the male partners, there's sperm production every 3 months or so. You get new sperm, and there's always a good mix of old and new sperm. And that's why men can have children much later in life than women. And that's where the biological clock comes. Because you get your batch, and I often compare it to milk. If I give you fresh milk today and I say to you, put it in the fridge, keep it there, no power interruption, no load shedding, just keep it as is in the fridge and check it 2 years later, you'll find that it has gone bad.
Yeah.
Nothing has happened. It's in the best conditions, but because it's been there for so long, it starts changing taste. It's the same thing. Because you've had these eggs and they're with you every year, until you get to menopause or until you die. These eggs, they lose their power or they lose their quality over time. Now, that's the quality part. And there's a separate thing, which is the number part, where AMH comes in. AMH looks at the number, the pool of eggs that are still in the eggs. And that number also declines. And the decline increases towards 40 years and beyond 40. So it's not a steady decline. It's sort of the decline, the rate of decline increases the older you become. So you may be left with 20 eggs now at 20, because the rate of decline is much less. 21, you are left with 18. But if you are left with 20 at 40, at 41, you may have nothing. You see, because the rate of decline is so fast. So that's one thing to bear in mind. You always look at the number, you always look at the quality. And because everything is pre-programmed, or you get your stuff from a young age, you can only live healthy and delay what we call aging processes. But then the aging will happen. How fast it happens, nobody knows. But I assume the healthier you are, if you eat healthy, you live a healthy lifestyle, you delay aging somewhat compared to someone that just doesn't care. So there's no way of saying, how do I get new eggs or fresh eggs? Or that's not going to happen. But you can say, how do I, age gracefully, so to speak?
Yeah. Okay. Thank you, Doctor. Our very last question is, what other tests besides AMH can give a more complete picture of a woman's fertility potential?
The greatest test for fertility potential is fertility itself. Make a baby. Because you can do as many tests as you want.
Yeah.
At the end of the day, you are not God. So the true test that is a yes or no, black and white test, is whether you're pregnant or not. That's number one. But we can estimate, because we are people, we are in this world. So there are certain tests you can do. One of them, yes, AMH is a very good one.
Yeah.
The second one is, if you're going to look at your fertility prospects, and this is just concerning the ovary. Remember, your fertility potential has got all other issues. But if you're going to talk about the eggs or the ovary, you want to know that the ovary is functioning well, and you want to know the ovarian reserve. So the test there is the AMH. Is a scan called antral follicular count, where we count the follicles that are younger than what we know. And those are the follicles that have the potentials to go and make eggs. So antral follicular count is very important. I've mentioned the AMH. But remember, all these tests, they tell you today. That's the problem with this test. If you do it today, it doesn't mean it's the same 6 months later, a year later, or 2 years later.
Yeah.
So that's just a disclaimer that everyone needs to know. So if you were to get up and say, hey, am I fertile or not? The first thing to do is to make a baby. Let's see. Okay. If you're struggling, then you come to us and we'll check the AMH, we'll do the antral follicular count. We'll check that perhaps you haven't gone into early menopause, which is where the FSH, it's a hormone, follicular stimulating hormone. You test that. If it's high, then you know that maybe you've gone to early menopause. But yeah, the biggest test to check your fertility is whether you are having your periods every month as you know it. And the most accurate test is actually having a baby.
Okay, thank you very much.
There's no than anyone else.
Thank you very much. I actually got another question that's not on my list. I'm always having an extra question, but it's after I hear what you say. So
slip it in.
Yeah. So, a lot of women are saying like, okay, I've been told I've got low ovarian reserve, that type of thing. What can I or my sorry, the quality of my eggs isn't that good. So what supplements can I take? So I know you are explaining it, but maybe just for this video, if you could just say like, what is it that they can take? Can you take something to assist in getting better quality eggs when it comes to, doing IVF or doing any other type of fertility treatment?
Yeah. So I think the best approach would be to see if you are concerned about the quality of your eggs. You must see a fertility specialist.
Yeah.
Because it then depends on what is this quality that you're concerned about. Is it at the level of enzymes? Is it at the level of, whatever? Then whatever at that level, then we can give you something that we think can help sort it out at that level. It's very difficult to give you everything in hopes that something will work. I don't know if you follow.
Yes,
so it's always best to get assessed and see where is this problem at what level. Then we unlock that specific level, because it's very difficult to unlock eggs, the quality of the eggs. And that's why the only intervention that works is to fall pregnant now. Then you know that you've got the best quality of eggs today. Tomorrow they'll be worse than today. Number two is to freeze the eggs now, because you know that they'll be better than the eggs next year. So those are the two most important interventions for people who are worried about low ovarian reserve and the quality of their eggs, is to use them now compared to waiting for 2 years and in between trying to get vitamins and all of this, because really this is a finished product. Now, if you come and you want to change it from outside with vitamins, It's neither here nor there. The best thing is to take them out now, use them today, or bank them today, and they will stay at the quality of the second of, is it the third, second or the third? The quality of the 3rd of April 2025, if you take them out today. And you freeze them like that. Then you can use them a year later or 2 years later, but you know you've got eggs of the quality of 2025. I think that's the message that people must carry with them. Rather than thinking that taking supplements and vitamins will slow the age. You know, even us, we don't want to age as people. We do all sorts of things. We put sunscreen, we drink water, we eat greens, but ultimately we end up in pension, you know, or in old age.
So true.
So it's pretty much like that. Whatever you do, the egg will ultimately age.
Yeah.
So rather take it out today at today's age. Use it if you want to use it today, or bank it as it is, especially if you're worried that this egg is deteriorating very fast.
Okay, thank you very much, Dr. Matlhaga. So, doctor is at Hope Fertility Clinic. If you guys want to get hold of them, you can contact them directly. They've got a listing on fertility solutions. You can visit them on their website. It's Hope Fertility. Is it hopeclinic.co.za? Am I correct?
Yeah, Hope Fertility Clinic.
Correct. Yes, and you guys are in Johannesburg, so Gauteng. So you guys, if you want to get hold of them, the details are on my way on Fertility Solutions. They've got a Instagram page as well, and you guys can contact them on their website. So thank you very much, Doctor, for joining us today. I really appreciate it, your time, and I always love speaking to you. So hopefully we get to see you guys soon again.
Excellent. Have a good day.
Thank you. Bye.
Thank you for having us. Bye.